This all started from pre-existing stupid motorcycle accidents and issues back when I was younger. I have a pretty bad disc in my L4-L5. I have a pretty bad curvature, which looks like scoliosis, but it's not. It's a result of uneven linked legs because of my femoral break 100 years ago that I didn't realize. And I just got the shots in my neck done. I don't know if it's going to make a difference. I'm just trying to see if I'll get the same results in my neck that I have with the back. I'm a completely different person. I mean, I'm still fed up and I'm still kind of an asshole and I have a bad personality, but I'm able to sit long periods of time. I was a motorcycle mechanic for many years, not knowing that I already had a pre-existing back problem. My first motorcycle wreck was probably '93. Not knowing how bad I was, uneven spine and everything for many years. I worked at Sony Pictures, and during lockdown, I started realizing how bad my back was. It initially started with neck pain, and then I actually had to leave my job because I just crazy neck flare up. You know, my orthopedic place and the pain management, they've all tried to refer me to UVA hospital and get one of these reactivate multifidus / spinal cord stimulator devices. I guess it's because I'm a mechanic, but you're basically trying to trick your brain into thinking you're not injured. And that's just like cutting the stereo up when your transmission's making noise. I don't understand the point of that. They've recommended a laminectomy a couple times. I have a pretty bad disc in my L4-L5 that was initially a bulge, like 8 millimeters out. It was basically, I just had laminar tears. And a lot of doctors were either like, wait and see how it goes, or go ahead and do the laminectomy. And then I have a pretty bad curvature, which looks like scoliosis, but it's not. It's a result of uneven linked legs because of my femoral break 100 years ago that I didn't realize. Even though I have that pronounced curve, being an adult, they can't really correct a scoliosis curve even with the surgery. So I'm kind of in this gray zone where I'm not really eligible for a surgery to fix that, because if it doesn't work, the only next step from that to correct that is a fusion. I don't want a fusion, and it sucks that insurance doesn't cover this, because I don't know why they will pay for $40,000 experimental device that has no proof that it does anything. I've been on the messaging board. I've spoken with a lot of people that have had reactivate, and they're really excited about the first month. And then you hit them back 3 months later, and then 6 months, and they're like, yeah, now it's grown into parts of my spine. It's causing other problems. You can't remove these devices. You just can't. I finally went to Alternative Health and Healing down in Naples, and I got my first injections in the lumbar. I waited a few months to see how that went, and then I did the thoracic, and then I'm just now doing cervical today with Dr. Fedorzik. It was the only thing that's done any good, because before I did this, I couldn't sit like this and talk. I have a van that I've taken the seats out and have a dedicated mattress in the back. My girlfriend's driving me to appointments. I just couldn't sit. I thought the stem cell thing was a bunch of crap, and it's really expensive, especially in Florida, but it's been a year now, and I just took a train up here from Lynchburg that's 5.5 hours sitting, and I'm not even really sore. You know, I readjust myself, but I couldn't do any of this a year and a half ago. Ever since I started getting the Vitasil shots down in Florida, I'm able to actually sit on the bike and ride it for more than 20 minutes. I'm able to ride for a couple hours now. Completely different person.